Next topic, regulatory standards and compliance. Compliance with regulatory standards is a fundamental aspect of managing electronic health records, also referred to as EHR, in healthcare settings. Regulatory frameworks guide the secure handling of patient information and the implementation of EHR systems. This section outlines the key regulatory standards, focusing on Health Insurance Portability and Accountability Act, also referred to as HIPAA, and their implications for EHR management and usage. Next, overview of HIPAA. The Health Insurance Portability and Accountability Act was enacted in 1996 to protect patient privacy and ensure the security of health information. The law established national standards for the protection of individual health information and laid the foundation for various other regulations impacting EHR systems. Key components of HIPAA. HIPAA consists of several key provisions, including privacy rule, security rule, transaction and code set rules, identifier standards, and enforcement rule. Next, we'll review privacy rule. This rule protects the privacy of individually identifiable health information, also known as protected health information and referred to as PHI. It establishes guidelines for how healthcare providers, insurers, and their business associates can use and disclose PHI, ensuring that patients maintain control over their information. Next, security rule. The security rule complements the privacy rule by specifying requirements for protecting electronic PHI, also referred to as EPHI. It mandates administrative, physical, and technical safeguards to secure EPHI from unauthorized access and breaches. This includes risk assessments, access controls, data encryption, and staff training on security protocols. Next, transaction and code set rules. This rule standardizes the electronic exchange of healthcare related data, including claims, payments, and enrollment transactions, facilitating efficient and accurate health information exchanges. Next, the identifier standards. HIPAA established unique identifiers for healthcare providers, health plans, and employers, streamlining the identification and processing of healthcare transactions. Next, the enforcement rule. This outlines the procedures for compliance, establishing penalties for non-compliance with HIPAA requirements. It includes guidelines for investigations, hearings, and the imposition of civil and criminal penalties for violations. Next, the importance of compliance with HIPAA. Compliance with HIPAA is critical for several reasons. Firstly, protection of patients' rights. HIPAA safeguards patient privacy by granting individuals the right to access their health information, request amendments, and receive an accounting of disclosures. This empowerment fosters patients' trust and engagement in their healthcare. Minimization of legal risks. Non-compliance with HIPAA can lead to significant legal repercussions, including financial penalties, lawsuits, and reputational damage for healthcare organizations. Organizations must adhere to HIPAA standards to mitigate these risks effectively. Next, enhancement of data security. Following HIPAA guidelines encourages healthcare organizations to implement robust security measures, protecting patient data from breaches and ensuring organizational integrity. Next, EHR implications and best practices. Implementing regulatory standards and ensuring compliance with HIPAA in EHR systems requires several best practices, such as conducting risk assessments. Regular risk assessments should be performed to identify vulnerabilities in EHR systems and processes. Organizations must address identified risks through appropriate security measures and physical safeguards. Implementing access controls. Organizations should establish tiered access controls to restrict EPHI access based on employee roles and responsibilities. This ensures that only authorized personnel can view or edit sensitive patient information. Next, data encryption and security protocols. Organizations must ensure that EPHI is encrypted both in transit and at rest, alongside implementing secure login protocols such as multi factor authentication to enhance data security further. Next, staff training and awareness. Ongoing training programs on HIPAA compliance and data security should be provided to all employees. This educates personnel on best practices for handling patient information and promotes a culture of compliance. Next, creating policies and procedures. Organizations should develop comprehensive policies and procedures that govern the use and disclosure of patient information, ensuring consistent compliance with HIPAA standards. Next, other regulatory frameworks affecting EHRs. In addition to HIPAA, several other regulations govern the use of EHRs and patient information management, including High-Tech Act, the Health Information Technology for Economic and Clinical Health Act, also referred to as High-Tech Act. It was enacted in 2009 and promotes the adoption of EHRs and strengthens privacy and security protections under HIPAA. It expanded the enforcement of HIPAA rules and implemented breach notification requirements. State laws and regulations. Many states have laws that provide additional protections for patient information. Organizations must be aware of both federal and state regulations, as they may differ in terms of privacy and patient rights. Next, Centers for Medicare and Medicaid Services regulations. CMS established criteria for providers participating in programs that incentivize the meaningful use of EHRs, which involves demonstrating the efficient use of certified EHR technology while meeting specific quality measures. In conclusion, understanding regulatory standards and compliance requirements, particularly those established by HIPAA, is vital for healthcare organizations implementing EHR systems. Compliance ensures the protection of patient privacy, enhances data security, and mitigates legal risks associated with non-compliance. By adhering to the HIPAA and other regulatory frameworks, Healthcare organizations can build trust with patients, safeguard sensitive health information, and foster a culture of accountability within their practices. Implementing best practices for compliance not only protects patient rights but also enhances the overall integrity and security of EHR systems. As the healthcare landscape continues to evolve, staying informed about regulatory changes and maintaining compliance will be essential for health IT professionals and organizations to ensure quality care and secure management of health information. Thank you.